Student's elbow causes and treatment. The olecranon is a thick, large, bony prominence that's slightly curved. It's situated at the upper end of the ulna, forearm bone. It's the hard bony part felt at the back of the elbow. It's also the bony part of the elbow that makes surface contact when one leans on their elbow, thus the term student's elbow. The posterior surface of the olecranon is covered by a bursa. A bursa is a small fluid-filled sac that reduces friction around joints and helps to provide smooth movement of soft tissues over bones. In a normal state, the olecranon bursa has a small amount of lubricating fluid and isn't palpable from the surface of the skin. However, compared to many other bursae in the body, the bursa near the olecranon is fairly superficial, making it a common site for bursitis. When the bursa located at the olecranon becomes inflamed, irritated, or infected, it's called olecranon bursitis, also known as student's elbow. Symptoms include swelling that usually gradually appears, dissipates, and then reoccurs periodically with a chronic injury. Swelling usually suddenly appears with an acute traumatic injury. The greater the swelling, the more motion will be restricted. Pain may range from mild to severe enough to limit elbow movement. Severe pain is most often associated with trauma and infection cases, and pain usually intensifies with elbow movement and when direct pressure is applied to the elbow. Acute stage symptoms are characterized by swelling, redness, pain, and possibly a local sensation of heat, indicating inflammation. If coolness makes your pain feel better, then the acute stage treatment is recommended. Apply the sinew herbal ice on your elbow to reduce redness, swelling, and inflammation while dispersing accumulated blood and fluids to help restore normal circulation to the elbow. This first aid treatment is used in place of ice to significantly speed up the healing process. It reduces the swelling and inflammation more effectively than ice, allowing you to more quickly regain range of motion. Ice is not recommended because it does not help repair damaged tissues and keeps everything in the injured area frozen, causing the stagnation of blood and fluids and the contraction of muscles, tendons, and ligaments. In Chinese sports medicine, ice is not used and is considered a culprit in injuries that don't heal well. Massage your elbow with acute sinew liniments to relieve pain, reduce swelling and inflammation, break up clotted blood and stagnant fluids, and stimulate circulation of blood and fluids to help cells quickly repair damaged tissues. The Sinew Sports Massage Oil is recommended for use before and after exercise, sports, and strenuous activity. It warms and stimulates your muscles, increases circulation, and relieves tightness, hence improving your performance and helping to prevent injury. Chronic stage symptoms begin once the swelling and inflammation are gone, but you still feel pain, stiffness, weakness, and/or sensitivity in cold and damp weather. If heat makes your pain feel better, then the chronic stage treatment is recommended. Massage your elbow with chronic sinew liniment to relieve pain and stiffness, strongly stimulate circulation and blood flow to damaged tissues, and promote the healing of overstretched tendons and ligaments. Apply the sinew injury poultice on your elbow to significantly stimulate circulation and blood flow to damaged tissues, relieve residual pain and stiffness, and further promote the healing of overstretched tendons and ligaments. The Sinew Sports Massage Oil is recommended for use before and after exercise, sports, and strenuous activity. It warms and stimulates your muscles, increases circulation, and relieves tightness, hence improving your performance and helping to prevent injury. Thank you for watching. For more videos, subscribe to our YouTube channel. To learn more, visit sinewtherapeutics.com.